Rapid urbanization has long been associated with public health emergencies. The COVID-19 pandemic is no exception. Cities have been most severely affected by this novel disease, with social and psychological to financial and infrastructural impacts. Why are cities so badly affected? Some point the finger at population density. And indeed, this is an important factor in airborne diseases like COVID-19. But if this were the only factor, why have some densely populated cities outperformed others that are less populous? Recent evidence shows that connectivity is a much better predictor of local outbreaks than population density. The flow of people across cities for work, education, and daily activities increases the risk of disease transmission. Lockdowns are an effective way of disrupting the spread of disease. But the disruption to daily life by curtailing movements means that it can only ever be a temporary measure. How then can we make our cities more resilient to future pandemics? What changes are needed in relation to connectivity and human mobility? The way we design cities matters in building resilience to public health emergencies. Because city form varies substantially depending on local context, we need ways to measure its characteristics at scale and explore how it interplays with human mobility. The social distancing dashboard is one way we could make this happen. This interactive map-based tool considers both urban form and human mobility over time to assess the risks associated with the use of outdoor public spaces. By integrating high-resolution open data about the geometry of footpaths, the structure of the street network, the distribution of economic activities along streets, and estimates of pedestrian flows, we can understand how the form and dynamics of cities relate to exposure risks. Importantly, the dashboard can be adapted to the local characteristics of different cities worldwide. This can help city officials prioritize the use of open spaces, allowing for safe human movement on the streets. It also raises awareness amongst city residents, especially those in at-risk groups who want to navigate the city streets as safely as possible. Using an integrated Delft design approach, the social distancing dashboard blends data, design knowledge, and local context to help accommodate regional variations into locally customized policies and interventions. By designing with data, we can enhance our capacity to design more resilient, lively, and healthy cities.